Wow, this is just like being at home. You know, one word for me, and people do whatever they want. You know. Anyway, good morning, and welcome to day 2 of our Culminating conference in the School of Public Health and Social Policy. My name is Michael Hayes. I see that we have some new faces in the audience, so I just want to introduce myself. It's my pleasure to be the director of the School of Public Health and Social Policy. I also would like to, of course, to welcome those people who are watching online, family, friends, supporters, practicum placement advisors, and assorted others who may be joining us. Delighted that you could be here. I, of course, would like to remind us that we are meeting on the unceded territories of the Coast and Strait Salish peoples, and it is a fabulous place to be able to live, work, and play. I also noticed that today in our group we have 2 kinds of people. Thank you, Bev. Today we have 2 kinds of people in the audience. Those who are relaxed and presented yesterday, and those who have a different kind of complexion. But as I think all of you would have appreciated in yesterday's presentations, I think we saw just a terrific standard of professionalism, as well as a wonderful breadth of interesting and serious issues that relate to human health, community development, and population well-being. And so I think we will hear more of that today. Yesterday, we were, I think, very fortunate to have our opening presentation done by Catherine Chisel. I think she really inspired all of us to think about the ways in which the historical development of state involvement in social services, human and health kinds of concerns, community development, and so forth, had waxed and then waned quite substantially over the course of our lifetimes, and the consequences that that has for being in community today, wherever our communities are. Today, it's my great pleasure to welcome Dr. Richard Stanwick, who is the Chief Medical Health Officer for Island Health. And picking up on yesterday's theme about the history of it, Richard will be speaking about what the future might hold in the public health sector writ large. Richard, of course, is extremely well known, not only in Canada, but around the world for his leadership in the public health sector. He has been a particular champion of local bylaw enactment around smoking cessation and smoking bylaws, and has been pilloried in the press for his leadership, and yet he continues to fight the good fight. And today he has prepared for us a new presentation. I'm under the, or at least I am of the understanding that this is being presented for the very first time to a public audience. Richard, welcome. Thank you.
Thank you very much. It's a pleasure to be here. I was actually surprised that Michael invited me back after last year, but as he said, he's a glutton for punishment, and I don't know if this is another form of penance for him. But thank you very much for the opportunity to be here. And it was quite interesting hearing what your opening speaker addressed, the whole issue of basically the evolution of policy over time. I'm actually following a similar tack, but more so from learning from our history and perhaps emphasizing evidence. And I'm going to perhaps take you down a different journey. That one may be in social policy and community. I'm going to just take you down a journey in terms of where we have come in something that still is the #1 cause of the reason why an individual actually will not see their next birthday up to about age 45, and that is because as a result of injury. I'm going to focus on child injuries and really look at the different policies that have basically been formulated and where we're possibly going, because we keep thinking in the 21st century it's going to be bold policy initiatives, and when certainly there's no shortage of subjects. When Michael said, you can talk about anything you want, I had almost a panic attack because of all of the opportunities in terms of where we're going to be going in the 21st century. I mean, just within the last couple of days, speaking to Arlene Patton, the Assistant Deputy Minister, about what are we going to do about e-cigarettes, what are we going to do about marijuana. And I figured, wow, I mean, it's really an exciting time because there's just going to be no shortage of challenges. But as individuals who will be in the policy arena, it's not just those new policies that you're going to have the fun of dealing with. And I was speaking to Patty Daly because just yesterday she was talking about the whole marijuana dispensary issue, and she's been euphemistically now called the Queen of Marijuana for the city of Vancouver. And that's certainly new and novel ground. But a lot of the gains that we seemingly have realized are not necessarily so basically guaranteed into the future. And I just wanted, in terms of this presentation, highlight the accumulation of evidence, and certainly I'm sure you've had this drummed into you by Michael about the importance of evidence in driving good policy. And just for fun, I think it's also that what I intended to do is to show that in this presentation, there's all sorts of really good sources and different sources of evidence you may wish to use. And perhaps one of the things that you should never allow yourself to do is have your imagination limited to using PubMed or randomized clinical trials, which of course in public health we really don't expect to see randomized clinical trials of parachutes, for example. I'm not sure too many people would volunteer for that. But this morning, I just really hope to give you just a flavor of where we've been, where we got to, and some of the things that you're going to be facing in a very changing world. So, very quick history of injury prevention in Canada. This is sort of taken from the lens of people where we formalize the field. And so I'm not going to bore you to death with all of these things, but it's not that old a field. In 1960, we really started getting organized. The Canadian Pediatric Society got going. John Reed actually talked about injury prevention. Haddon was basically putting his stuff together in the early 50s. And these are just, a lot of activity in the 1980s. It's not that you need to read or recall any of this, but the 80s was a great time because people were coming together. When we had our first big injury meeting in the early 1980, of people who are interested in injury control in Canada, there are more people in this room than attended the meeting. And so, yet by the end of that decade, it was basically easily 3 times the size. So it was an exciting time. So we saw further and further maturation of the field. And this is just to give you an idea that the whole idea, this maturation and excitement around this field really was associated with creating a variety of venues. And these were some of the seminal publications. We finally even got Health Canada excited. For I don't know, there's not too many people in the audience who'd remember these documents, because I think we'd have to drag Irv Rootman here from another faculty who actually was involved in some of these early documents. Of course, he would claim he did it at some time in grade school, but these were the sorts of documents, and we really discovered injury control, and that there was basically now setting targets for ourselves as a country. And we of course always still rely on good hard data. And I always like to throw in one of my favorite cartoonists, and of course if you really believe in good data, that Far Side was probably a master, Gary Larson in his cartoons, in terms of measuring basically things. But really, we really started going forward. But one of the frustrations, and certainly this is one of the ongoing things and challenges that you're going to be facing, is that in Canada, how have we done in terms of where the progress that has been made? And generally, in fairness, that we have done well in terms of both policy and from the curative side, in terms of reducing, basically childhood deaths by all causes. But injuries, certainly the slope is a lot slower. And I hope this pointer works and I don't blind anybody. But here we are in Canada in terms of where we rank in terms of basically the rest of the world. And it'd be fine, but there's certainly countries like Spain, Ireland, Belgium, even Greece and the Netherlands are doing better. And the irony is we really haven't improved substantially. Even the more recent reports continue to show that we struggle in this area. Now this is what, and I promised you we'd get a little historical and perhaps at some point a little hysterical about what we've done in terms of basically reducing childhood deaths under the age of 20 in this country. And this is really important, one, to celebrate the accomplishments that have been realized in a whole variety of areas. And I'm sure the initial lecture on social policy has had a huge impact in terms of addressing the determinants of health and how that has contributed significantly to that decline in deaths. But let's see if I can get this to work. This is basically what's happened, though, in terms of childhood deaths. And what's really interesting is that we've seen a decline in deaths over that same period of time. But if you actually look at infants, and we see this rather curious increase in basically from about the 40s to about the 60s. And I'm going to ask the group, as Michael said, there's a time for questions afterwards. So in question period, I'm going to ask the audience what they think was responsible. Why did we see this, basically in terms of injuries, and particularly in the very young, under a year of age, why we have such a high rate of injury-related deaths. So if you're going to really look at a problem, it's sometimes worthwhile to go, and just for fun, and this was an exercise I did to see if, in fact, we could really learn something from non-traditional sources. And for $10, it was the cheapest paper I could find, and it was also Winnipeg, which I have roots to. You basically have unlimited access to the paper for a period of a month. And you can search on just about anything. And so what we specifically looked for over time, going back to at least the old newspapers, you could probably do this with the Vancouver Sun, or I guess the Times and Victoria or Montreal, or any of the newspapers, but looking at what happened in terms of the injury patterns. Now at the time, the interesting thing, if you look at the population pyramids, and again, if you're basically interested in data and the populations you're studying, it's really intriguing that when you look at these curves, you would really think that what one would see is a true pyramid. But if you look at it, and again, this is a question perhaps I don't know if it would be fair to ask the audience, but what does that population pyramid tell you? Perhaps can I ask for an answer now? Does anybody want to speculate? Why is it sort of narrow and then all of a sudden you've got the bulge? And this is fairly typical of most cities in this era. Go ahead.
I think the under 5 years is because or a fair number of the men were at war in Europe.
Okay, but no, these are people. This is back on address. So why is it narrow at that age? I mean,
this is injury.
Not just injuries. I mean. What this shows is that if you made it to 20 and survived all of the childhood diseases, you actually had a pretty good chance of living a fairly, at least 40 years. That if you weren't taken down, just for interest's sake, just walk through Ross Bay Cemetery sometime and just look at the tombstones. That in itself is another exercise which is very informative if you're really interested in understanding social policy and the ramifications in the populations that are affected. So why did the kids die in those age groups? And it's really amazing. It's very similar. They died of automobile crashes. A child, and this is still very common, choked to death on basically a marble. A guy gets a gold watch for trying to rescue somebody from the river. That, it was fascinating. These are the same causes, and I'll show you through time, and I won't bore you with each one of these, because I find it hugely interesting to see that kids continue to have the same sorts of things. They choke on things, they drown, they burn, and of course, the motor vehicle crash. And so, and interesting, the kids falls from an automobile. That it tells you something that 16-year-old sustains when friend. Well, of course, this is whenever you're going to show this to an American audience, if you want to relate, what you have is a 16-year-old who's shooting at one thing and hits another, which unfortunately in my career I have seen fairly regularly, where you put kids together with guns and it's a rather dangerous combination. But again, it speaks to some very common patterns. Car overturns, falls from automobile. And again, I won't bore you. I just find this hugely interesting. But, of course, being from Winnipeg, you have to have something like this where you get, this would probably make the front page of every newspaper across the world today, that a kid would be eaten by a bear. because of course in the news media, and I'm sure one day, Michael, you'll have to get somebody like Barb McClintock or others to speak from the media's perspective, that a kid being eaten by a bear would probably knock the Nepal earthquake off the front pages for a few days because of the novelty. I mean, earthquakes happen fairly regularly, unless they're catastrophic, they don't make it. But all of the automobile mishaps, which predominated, certainly didn't warrant it. And again, we see the city growing. The population pyramids, again, just a bit disappointing where we still see that narrow part. But the other component is, of course, we also see the immigration into a lot of our cities. And again, same sort of thing. And why I'm emphasizing, again, this idea that people should be out on the river, again, car basically capsizes. And again, of course, the whole issue of kids with trains. And this again, and I'll just speed this up, but the population pyramid actually continues to smooth out a little bit as we see better and better survival. But again, the causes of death right into the 80s, continue to be very, very similar. And this is one of those emerging patterns, like why are these things happening? And so part of it is you see a repetition of pattern, and again, the top reasons continue to be the same. There's the fire, there's police, and of course, the thing that which was so common, and I guess you'd have to be almost, Michael's much younger than me, so I'll just speak to myself, but when we used to have long weekends, the speculation would be if in Canada, the number of deaths on our highways would exceed 100. Can you imagine? They actually would consider it a good weekend if less than 100 people died on our roadways on a long weekend. That's what basically those days were like. So moving forward, we see again, now we're starting to see, a lot of the individuals surviving are baby boomers pushing their way up and younger kids. But the injury patterns, crashes, ambulance driver hits it, roof collapses on school, girl crushes by tractor. Farm injuries is a whole other area. I mean, if you want to delve in. But again, the data is very, very similar. Population continues to show the bulge. In 2009, we basically find ourselves still frustrated in terms of the fact that we see kids that are still being hit by cars, if I can make this work. And again, the auto collapse, fire, etc. But the big difference is that we see a dramatic reduction in the number of events over time. That I will show you, and again, I guess this is a very detailed graph which just speaks to it, but the number of incidences over time still show us that we still see the motor vehicle fires, burns, and poisonings. So I'll just skip this. But what we do see, and this is where we're finally starting, and this is our colleagues in policy and health promotion are coming forward and making these warnings that that we really find this unacceptable. But it took almost to the 60s before people started getting really concerned. And so we finally started seeing things such as publications. This is from the 1980s. This is a historical document that we actually started caring about the environment in which babies were cared for and the type of equipment. Now, again, Farside came up with a number of sort of toys never to buy your child. The interesting thing, and while this is a facetious bit of toys to purchase your child for Christmas, I don't know if people noticed, but the Toy Testing Council of Canada, which used to give rankings for toys, is closing its doors because of the lack of funding. I think they go out of business as of today. And it was fascinating because they were a very big agent in terms of identifying what risks were. And we certainly saw in childhood basically injury patterns. One of the favorites, and I'm not sure people even recognize what these things are. And Canada actually was one of the first nations to actually ban the use of these devices back in the 1980s. And it was as a result of really good data mixed with really strong policy. And it was really fascinating that this was a little closer to the truth than people would realize. And it really took papers out of Winnipeg, Toronto. And I mean, believe it or not, we actually had a case, or a case report in Toronto, where a child went down the stairs in a walker, sustained a fractured limb. Mother warned about it. Child put back in the walker, and the second time went down the stairs, and this time sustained a serious head injury, which this child never really did fully recover from. And it was by basically putting together the injury data coupled with the idea that these were not safe, that people had to deal with the devices that could travel basically 3 meters per second. That's how fast a kid could propel it, which is faster than most linebackers in the CFL and NFL can react. So that tells you how tough mothers would have to be able to prevent these events, because many of them were witnessed directly. We did really radical things too in Canada. We got rid of lawn darts, which in fact was the subject of scorn, even though we actually saw people walking in with these metal projections sticking in their heads. And of course now what you do is you get plastic, which don't cause harm. But I mean, occasionally you do have to be ready for some scorn, where after the minister banned lawn darts because of those metal prongs, he said, typical in Canada where guns aren't available, that somebody walks in with a mask on and pulls out a lawn dart and holds up the bank with a banned weapon. Only in Canada would we be so benign. But it was this whole idea that we were finally getting a culture of safety. And so we started talking about flammable clothing. And this was one certainly that, there became and I'm trying to set a stage that the public started to accept that, we were really out there looking out for their safety. That, the public actually believed the government was looking out for them. And certainly during that decade of the 80s and 90s, one of the things were these loose and flowing garments, either made of cotton or cotton polyester blends. And this is why these things were very dangerous. And this is a matter of, I have the films, but they're just a little too graphic. And this is in the course of about 15 to 30 seconds. And that's the sort of pattern of burn that can occur. And this is from candles, from fireplaces, from any other sort. And that's the sort of burn. Some of the worst ones were because little girls were, dressed in these beautiful little flowing cotton garments. This is what happens with these, and I'll tell people when to look away. But that's the sort of flame, basically what happens with these garments. And that's what basically it looks like after 30 seconds. People may wish to look away because I'm going to show you what really happens, because that's what happens to a real child. She died after 2 weeks of that burn. And so it was the combination of outrage in the medical community, the epidemiology community, and basically working and pushing change forward. And so we basically went, instead of adding chemicals, we just said that if you're going to make a garment out of cotton, it's got to be tight-fitting. This is what happens when you apply the same flame to a tight-fitting garment made out of the same fabric. You get a 3% burn. We also, in Canada, and this is really a story that's worth telling, got child-resistant lighters in by basically doing a Canadian study that the Americans adopted, and then once the manufacturers started making lighters to the American market that were child-resistant, of course, Canada then basically ended up with child-resistant lighters so that children wouldn't get access to these lighters. So, again, it was a time where there was great excitement about how to use these lighters. Of course, that meant a lot of people gave up cigarette smoking because they couldn't light their cigarettes. That's child-resistant, adult-proof. And the government went so far even recently of being able to give the minister the power to ban a product. Believe it or not, people thought that the minister could just say, this product's dangerous, it's gone. And it really took a tremendous amount of energy to do it. And in particular in motor vehicles, and of course, Gary Larson captures some of the things that, I'm actually of an era where, seat belts were not mandatory. And that, this was not unusual to see kids playing in the back of a station wagon. Standing up, having a good time, not interfering with their play until somebody basically hits the back. And literally, the children go out the back. And, and again, the films actually show the child in red actually sustaining a fatal head injury. And one of them actually slides under the car and the bumper actually takes his head off. And these things actually happen. The other one was a favorite, and I'm not going to criticize the royal family when they took George home, but they took George home this way. And apparently the media were told not to criticize the royal family for taking, basically using a practice that we basically got rid of in the 80s, because this is what happens when moms used to carry, and we used to do this in our nurseries. This is what we actually did. Is you put the mom, the baby in mom's arms in the front seat of the car. And of course, mom often wasn't belted up because she was uncomfortable from, the delivery. And this is what happens when you basically slam into the back of another car at about 30 kilometers an hour. this is called using your child as an airbag. And we have definitely, and certainly I've got colleagues who have seen children crushed by their mothers. So, and this is something that I actually saw and why I got into injury prevention in the first place. Child placed beside the mother until you stop, and then the child slams into the dashboard. And I had a kid come in in their christening dress with a radio knob in her head. And that was her burial dress. That's what we used to actually tolerate. I mean, it's kind of amazing. And of course, this is the little lighter side, but this idea of children being allowed to play and be rambunctious. And of course, when I first started giving my lectures way back when I started my career at the University of Manitoba back in the late 70s, you had to actually, like True Detective, where they disguised people who would actually be seen doing something. Well, you had to find a picture of a woman who would wear a seatbelt who was somewhat attractive, but you had to hide her identity. The privacy commissioner probably insisted, because who really was attractive and wanted to wear a seatbelt? And the thing is I bought my first vehicle. This was the campaign that they used to sell the cars. This tells you how the culture was that was faced in those times in terms of policy. This is the Nova geriatric mobile, which now I probably would definitely fall into. But you notice how prominent the seatbelts are on those two individuals. Now, if you're really cool, like I was when I was an intern, you bought the SS version with the 350, which is now a classic, but they airbrushed out the seatbelt, or the guy is sitting on it, which explains the pained look on his face, and that's what it was really like in the 1970s. We were not that cool. And of course, when we finally started getting seatbelt legislation in '82 in Winnipeg, this is the sort of response, was that the media celebrated the individuals who were opposed to this policy. And of course, the thing was very rapidly, and this is taken from Winnipeg Sun, was that the media, of course, as soon as the opposition, the thing that cinched the policy was some poor person was not wearing a seatbelt, and of course sustained a very significant crash. And then, of course, it really helps when these things are shown, and occasionally the media can be your friend. And then, of course, what happens is you then get the one case about 3 weeks later where you get, and this is one of those things that is a truism, if you're going fast enough in your Porsche 911, as we found out in a very famous crash with the Fast and Furious actor, doesn't matter what you're wearing, it doesn't make a difference, but the media love it. So we will just skip this. So what have we done? I mean, there's been some amazing progress. And again, I just want this to give you a sense of what you can accomplish if you go out there and are willing to change policy and to basically use the data. I mean, this is evidentiary that we can really take this information and make a difference. It may take you 5, may take you 10 years, but now children are being packaged, and sometimes the kids are the only survivors in motor vehicle crashes because they are packaged best of all. And of course, cars now have the built-in restraints. And again, this is the different styles of car seats. And of course, in British Columbia, thanks to Ian Black, I mean, just as recently as 2008, we finally packaged kids up to the age of 8 safely. Now, these things are recent. I mean, we basically had fights over the booster seats. We actually had to do a holiday cartoon, which helped convince a fellow by the name of Gordon Campbell, who now I think resides in London, doing something very important for our government, about the importance of booster seats. And sometimes you have to have a little fun when you're pushing policy. So what we did is we basically designed some holiday greeting cards and had basically kids from various, well, in particular Montessori school, sent Christmas cards to the premier saying, all I want for Christmas is a booster seat law. And so it doesn't mean that you can't occasionally have fun when you're doing policy, but it's really, really important. But I mean, it's really hard to believe that we started with basic seatbelts in '82, and the infant and basically the infant love seats, which GM put forward. Now, we basically, and that's of course another cutesy one, and these were the holiday messages. And so we also had the kids sing Christmas carols in the rotunda of the legislature, which is, I'm just giving you a few ideas of what you might want to do to be a little creative in doing your policy work. But I want to focus very briefly on what you may be facing in the future. Now, again, this was the whole idea of playground safety. And certainly we've gotten some really good standards, and all based on evidence on the same sorts of stuff, taking that historical patterns of injuries, whether it's motor vehicles, on flammability, and past these different standards. You know, and in particular, we're really concerned about infant falls because gravity is not a child's friend. If they do fall, you really want them to have it as a learning experience, not something that's going to be catastrophic. And so one of the things we did in the mid-90s was actually see if we could improve playground equipment so kids didn't get caught on sharp edges, corners. I mean, we had strangulation deaths. When I was in Winnipeg and still working on the death review committee for our college and physicians and surgeons, we had a child fall backwards out of a swing onto basically where a groove was created, water had frozen, and he sustained a fatal head injury by merely falling out of a swing onto ice. You just need to remember that a 20-inch fall onto concrete can be a fatal head injury. And ice is as hard as concrete. And so really, what if we improve the surfacing? Well, we basically worked with the injury prevention unit and identified a whole bunch of opportunities. And one of the things our licensing officers have done is they've actually become trained CSA playground inspectors. And so that not only do we have the standard, but our team on the island actually can and do identify hazards and identify them to daycare operators as well as school districts. And so what we actually do, in being very, very scientific, is that we use a machine called the Triax, which is, if I can point this thing, is this ball here is dropped from the height, and it tells you whether in fact that's sufficient absorbing material that a child will basically sustain possibly, and we do see fractured collarbones, we do see the occasional concussion, but you don't see the fatal type of head injury. And so that's a close-up of what's dropped, and there's an example of it being tested. And so what we do is basically tell people to top up the materials so that children basically won't sustain serious injury. And we have tracked these using incident reports. Now, this is of course just a little bit of humor. Now you think that we've really made lots of progress. Well, there's now, and this is what you're going to be facing in the 21st century. We're turning back the clock on, these things that we thought were a given aren't any, you can't have that confidence. I mean, right, anybody who's in environmental health will tell you, we're having a huge fight where people now want to be able to have the privilege of basically contracting all sorts of diseases we thought we had conquered when we started pasteurizing milk in the 1930s. They want the right to be sick, but of course then we're all going to pay for their treatment once they fall sick, because we all know how dangerous heating milk is to basically taking away the nutritional value, none of which is scientifically established. But people want the right to turn back the clock on a variety of things. So we basically are dealing with this on a fairly broad scale in British Columbia. The amount of time we spend in saying that natural disease is better, even when you get it at Disneyland. I mean, the opportunities, and some of those basically very narrow population pyramids, and I intentionally left them in because these kids never made it to be able to make it to their 20s. The natural disease certainly had consequences. And so this is the sort of response that, that somehow this is superior. And so we're definitely fighting those policy battles. So in terms of going forward, we're going to need people in the field to keep and consolidate and hang on to the gains that some of us thought were basically givens. That we are in a very fluid time where people are taking, because of the disappearance and the very success of the programs, of the policies that have been put in place, that they think that those problems have disappeared. And this is not just injury prevention. This is the sort of the argument where when we brought in some of the early standards, people panicked and they said, this is the ideal playground, that what you do is you just throw the kids out there and they won't get injured. Well, I'm not sure how many of you would find that a particularly appealing and challenging playground. It's great for imaginative play because that's about all you could do. But in truth, there was a bit of an overreaction, but the pendulum has really swung to the point where Reader's Digest is now promoting the idea that what we're going to see is a revolution in play. That the kids have to be challenged, supposedly. They have to experience real risk. And I mean, it's the idea that they really supposedly, and I can't believe this, you got to let them play with fire. And you think that, this is a joke, that I'm basically telling you that, that I'm doing this just to make a bit of light and as Michael said, make this entertaining, if not, educational and informative. And you think that this idea is something that is really fringe. And so this is where they basically came. But it's starting to get traction in mainstream injury control, where Dr. Sandsetter, on the basis of 6 hours of observation of play in Norway, is now saying that broken and fractured arms and legs aren't considered serious injuries. And no mention of concussion. And Wall Street Journal is carrying all of this. And to make it even more interesting, our own BC Injury Prevention Unit is now promoting really risky play. And it's a huge schism in the injury community where the question is, do children really need to have the super risky play where they are at risk of serious injury to normally develop? And so this is a policy area that you are going to be basically engaged in and dealing with. This is what a risky playground should look like. You got to play with fire. You got glass lying around. High things, no surfacing. The dirty mattresses. High surfaces, sharp edges, because this is how you supposedly learn, through really risky play. And these are basically pictures of UK playgrounds that advocate for this. And of course, you really want to make sure that not only can you catch fire, that you can fall and get a concussion, you can also drown. I mean, you've got to have water as well. And, doesn't this look and sound a little like something I just showed you very early on in the presentation, like about 100 years ago? And, the concern is, this is in the face of more knowledge saying how devastating concussions are. And sports that were previously considered safe, like soccer, are now being associated, particularly girls' soccer, with significant and serious head injuries. And as we now use these more advanced techniques, and again the traumatic brain injuries, how our heads really aren't particularly well equipped to handle these sorts of trauma. So here we have a field that's competing with different forms of evidence. And in fact, I just finished consulting with the Victoria School District as their school medical health officer. That's one of the roles that medical health officers have, about their policy around concussion, because it's being recognized as so significant. And so we got a whole bunch of evidence coming out, hey, we got to avoid this, we got to avoid this. And the other piece that's not even included in this discussion, and this is where life is getting really interesting. I don't know if people looked at the newspaper today, but apparently a new major milestone that we have to assess kids on is, at what age do they first touch their first screen? Because apparently by the age of 1, most children today have already touched and encountered a touch screen. But the question that comes up, and this is where you have to add it to your mix, is what is real versus virtual risk? Because one of the things that we have looked at, and that is this whole engagement in terms of the internet and particularly games, of how that is responded to by the adolescent brain. And it's fascinating when you look at this idea of, and what perhaps is why kids aren't on our playgrounds, is that when you look at what they do in terms of the internet and particularly the games, the brain of the teenagers during those games light up just as if they're experiencing the real risk. And so the real question is, what is it that we have to deal with? Do we have to have real risk? Do we have to have a perception of risk? And as we can see, we can actually create virtual risk. And what are those things that are going to be necessary? And I think what's not being debated is whether, in fact, that is necessary for normal childhood development. And how do we titrate that? Because we have to create policies around that. Now, this is what's really fascinating in terms of those play spaces. Those horrible playgrounds that I showed you that are supposedly these new risky ones, those are the ones that poor kids used to have to play in. versus kids who lived in affluent neighborhoods. And look at the difference in injury rates. As we improve playgrounds, what happened to rates? And nobody wants to talk about the fact that, in fact, the crummy play spaces and the dangerous areas where kids used to play and who were poor experienced a much higher rate of serious injury. And yet we want to go back and turn that curve backwards. At least some very prominent, basically, injury control people supposedly want that. The thing is, we can create really challenging playgrounds, which can be a lot better, and certainly with the right surfacing, give the idea that these kids really can push their risk level. And it's, and you can go high. And a fractured collarbone, that's 3 weeks of discomfort in a sling. A fractured femur, despite what Dr. Sandstetter says, is not a minor event. That's basically at least 6 to 8 weeks and sometimes longer, and multiple procedures, but that doesn't even speak to the head injuries. And the most interesting thing, and I certainly hope one of my, somebody I'm working with in terms of our injury reports, in looking at our daycare injuries, the 2 most severe injuries occurred in what would be considered risky play situations, where kids were playing with a driftwood structure, and basically the child essentially got hit by a massive piece of the driftwood on this structure and sustained a severe compound skull fracture. The other kid basically, again, similarly sustained a serious head injury. And these are somewhat being dismissed. So, this is something I'm bringing to you as literally we're fighting today. Barry Pless, who was probably the guru for injury control in Canada, has written a very strong letter speaking to the danger. So this is a huge policy debate. And this is the sort of thing that I think you're going to be encountering more and more, where the old ways are the better ways. So really what we have, and this is, I won't bother with this. It's just basically this whole idea of, we are passing that some of us have been involved in some of that injury control stuff and certainly reducing injuries and certainly working very hard on those. And I'll say a bias. I was involved with the first CSA playground standards, where we thought we were actually doing kids a favor by reducing those very serious injuries. The dilemma is, what other areas are we going to be turning the clock back on in the name of, and again, I don't know what it is, the perception that we're going to be improving things, but I think what the message that I just want to leave you with is, no policy that we have created or that you may be involved in creating can be sustained without further nurturing and involvement and awareness. And not that we don't want you to go forward and deal with medical marijuana or e-cigarettes, but some of the stuff that some of us who've been around for a little while and a little longer in the tooth is far from secure. And so that it's always open to challenge, and sometimes it's on the basis of very magical thinking. Other times it's backed up by very, very critical individuals. So Michael said I could talk about what I wanted, so it's his fault if you don't like the lecture. If I made you uncomfortable, that was my intent, because this is very, very distressing to see that sometimes we are basically reducing the opportunity to do the good that we think we want to achieve. So I'm really excited, and thank you for the opportunity. And I guess if I get invited back next year, then Michael won't be so displeased that, because he always warned me sequels are always really, really bad at the box office, and even worse in the lecture theater. So I leave it to you.
Thank you. Okay, we do have time for a couple of questions. I appreciate that we're getting tight. That's okay, it's all good.
Hi, thanks for your wonderful talk. I was just wondering if you could speak to the notion of policing as a public health, acting as like a police. We saw a little bit of resistance with the seatbelts, but especially when it comes to freedom to make choices whether to vaccinate or to give your child soda, or how do you see that playing out? Because that's usually the argument that most people go back to, is it's my right to not vaccinate my child. Or
yeah,
I hope that question made sense.
I think, and certainly the anti-vaccination one, and certainly, I mean, some physicians said I'm not even going to see patients who won't go, with what I want, or, the co-sleeping thing, which is a huge issue right now in terms of this. I mean, if you really want to get people upset, start talking about circumcision in males. And, these are all hot button issues. Some of them, the science at least is debatable, where, there is a difference of opinion, how it's weighted. But when you get into the policy piece, and this is, the only piece of advice is really know your evidence well. But then, probably the best thing we can do, for example, at the current state of knowledge, for example, pick on co-sleeping, we can definitely show that you can have the child by the bed and be close to it and give it all it's needed versus the number of overlay deaths, which I have personally reviewed literally 40 or 50. And, the people just don't get it. And sometimes it was, all I did was have a drink before I went to bed, and the mother or the father just slept too deeply. And, one little error and it costs the life of the child. Is that really worth it? So the part of what we have to do, and this is where we're going to have to even be better than ever, and that is, how do we become superb risk communicators as to give people a true sense of risk? The fascinating thing is, and again, it's well established in literature, there's an article in Pediatrics, about people who, there's probably about a third of the population who haven't really made their mind up or who can be really swayed. And there's probably about 15% that no matter what Michael or I or anybody tells them, and we convince them that they're wrong on this because, the high risk of bacterial infection, is the reason you shouldn't do it. Well, then they'll shift and find another reason why it's a good thing to do what they want to do. And so there's going to be a hardcore of the population you will never convince, but do not give up on what is probably anywhere 30 to 40% of the population who are getting all sorts of misinformation on the subject and are really confused. And yet they will look to people in the field who have credentials, and as long as you can put together a coherent and cogent argument, they can and often will listen. And sometimes the biggest impediment, and I'll just pick on the immunization thing, a lot of the parents say, yeah, actually I was, but you make it so damned inconvenient to get my shot that, for public health, that sometimes you think our surgical wait lists are bad. You should see our waiting lists for immunizations. And so sometimes we're the ones that are the culprits for why people aren't doing what we want them to do. And so we have to sometimes look in the mirror to see how well a job we're doing. But you are going to have to be the best generation of risk communicators ever, if there's even a hope of basically making these policies work. If you're going to be getting into policy, it's going to be a means of being able to frame it in a way that a variety of audiences do so. And it's not going to be using the free press. You notice I stopped using it after 2009 because you know what? That's not a main means of communication. But previous to that, that's how we learn things.
Thank you, Dr. Stanwick. That was a great presentation. It's more along kind of just more of a general comment that I think the common thread for all of this is really public awareness campaigns and how important they are. And you introduced an interesting public challenge in that a lot of people feel that they are entitled to live life with a certain level of risk. For example, aging in place is a good example of the being allowed to live with risk. And I wonder, what are your thoughts on potentially just having time in nature and how that can meet the need to live a little bit in risk? And that really, children need the opportunity to critically think about their environment and why that environment versus a virtual space helps promote that.
Excellent commentary. The whole idea, in which again this is almost a lecture unto itself, is this idea of even children being able to adequately assess risk and realize what is in fact appropriate risk taking. I mean, a good example is that in terms of even something as simple as getting kids to walk to school, we want to encourage physical fitness. The average 9-year-old boy still is probably highly challenged to be able to judge the speed of cars on basically a street with cars going in two different directions. Girls, well, you guys got way all over us. I mean, males' brains mature slower, I know. We don't even have to talk about that. And I'm not trying to pander to this audience, which is disproportionately represented in terms of gender balance. It's just true. And so part of it is, in terms of creating these structures, et cetera, it's matching developmental abilities and challenging those abilities and creating that opportunity of perceived risk. And the virtual piece, I mean, it's something we're really wrestling with. And this idea of just screen time itself, where, for example, the Canadian Pediatric Society says no screen time under age 2, and 2 hours a day after that, if we're going to keep their fitness levels. This is why I think you're in a most fascinating time, because never have we ever had so many devices that are going to improve life, but at the same time, if you look at what's happening in terms of teen obesity rates, and just even activity rates, it's not even, they're telling us more and more, don't pay as much attention to BMI as just number of minutes out there doing something. That in fact, in terms of this whole idea of basically extending life, in terms of reducing your likelihood of premature mortality, the person who is totally sedentary is worse off than somebody who may not have an ideal BMI but is out there doing things. So, part of this whole exercise is that you're going to have to be so well equipped. You'll have a group of individuals who, quite candidly, with the University of Google, be there, and it's, as somebody said, it's the best misinformed group of individuals you'll ever have the opportunity to address. But your job is going to be able to convey those policies and that risk to you. So again, I'm really excited. I thank you for the opportunity to perhaps make you a little uncomfortable and realize that the world you're going into, like most things, are on policy, isn't it? Well, the old comment about making policies like making Polish sausage. Very messy. So thank you.
And you don't want, thank you. Very messy, and witnessing it is not for the faint of heart.
Thank you.
So, Richard, thank you very much. There's so much in what you've said. I guess for me, one of the biggest things that I think is at root of what you're talking about is the potential failure of success. That if we forget our successes and come into a world where we just take them for granted, therein lies the potential for failure. And that's a hard thing to get one's head around. And so I really do appreciate, there's so much in what you've said, but I think that's a great message for us to be pondering. And a little token of our appreciation. Thank you so very much. So we're going to take a short break. We're running a little bit behind schedule. I'd like us to be back and ready to start by about 10:05, please. There should be refreshments out in the main foyer. For those of you watching online, thank you. We will continue in about 15 minutes.